Welcome to Ulosca channel. Access all nursing practice questions. ATI Pediatric Nursing Unit 1 Assessment Practice Questions with Answers.
Question 1. A nurse is assessing a 12-month-old infant during a well-child visit. Which findings should the nurse report to the provider? A. Uses 2 words. B. Pulls to a standing position. C. Does not sit without support. D. Cruises around furniture. Which one is the correct answer? The correct answer is C. Does not sit without support. Explanation. By 12 months, an infant should be able to sit independently. Inability to sit without support at this age could suggest developmental delay or neuromuscular disorder and warrants further evaluation. Question 2. Which immunization is contraindicated for a child who has a severe allergy to gelatin? A. Hepatitis B, BMMR. C. Inactivated polio vaccine. D. DTaP. Which one is the correct answer? The correct answer is B. MMR. Explanation. The MMR vaccine contains gelatin, which is used as a stabilizer. A severe gelatin allergy is a contraindication due to the risk of anaphylaxis, making it unsafe to administer. Question 3. A nurse is reinforcing teaching with the parent of a 4-month-old infant. Which action by the parent indicates understanding of injury prevention? A. Places the infant in a front-facing car seat. B. Keeps small toys within reach in the crib. C. Lowers the crib mattress to its lowest setting. D. Removes crib bumper pads. Which one is the correct answer? The correct answer is D. Removes crib bumper pads. Explanation. Crib bumper pads increase the risk of suffocation and sudden infant death syndrome. Their removal reflects current safety guidelines and appropriate injury prevention measures. Question 4. A nurse is assessing a toddler during a well-child visit. Which of the following behaviors should the nurse expect? A. Expresses likes and dislikes. B. Understands right from left. C. Knows how to tie shoelaces. D. Uses full sentences. Which one is the correct answer? The correct answer is A. Expresses likes and dislikes. Explanation. Toddlers typically express preferences as part of emotional and cognitive development. More advanced cognitive and language skills, such as full sentences or knowing left from right, emerge later. Question 5. A nurse is caring for a preschooler who refuses to take oral medication. Which strategy is appropriate to encourage cooperation? A. Offer the child a reward after taking the medication. B. Restrain the child and administer the medication. C. Tell the child it tastes like candy. D. Mix the medication in a bottle without informing the child. Which one is the correct answer? The correct answer is A. Offer the child a reward after taking the medication. Explanation. Preschoolers respond well to rewards and praise. Offering a reward can help gain cooperation and create a positive association with medication taking. Question 6. A nurse is preparing to administer an intramuscular injection to an infant. Which site should the nurse use? A. Deltoid. B. Ventrogluteal. C. Dorsogluteal. D. Vastus lateralis. Which one is the correct answer? The correct answer is D. Vastus lateralis. Explanation. The vastus lateralis is preferred for IM injections in infants because it is well developed and free of major nerves and blood vessels, reducing the risk of complications. Question 7. A 2-year-old child is hospitalized with croup, Which intervention should the nurse anticipate? A. Humidified air. B. High-flow oxygen via mask. C. For antihypertensives. D. Chest physiotherapy. Which one is the correct answer? The correct answer is A. Humidified air. Explanation. Croup involves inflammation of the larynx and trachea. Humidified air helps reduce airway irritation, improve breathing, and decrease the severity of symptoms. It is a first-line non-invasive therapy. Question 8. Which developmental milestone is expected in a 6-month-old infant? A. Rolls from back to front. B. Walks with assistance. C. Uses a pincer grasp. D. Says 3-word sentences. Which one is the correct answer? The correct answer is A. Rolls from back to front. Explanation. By 6 months, infants commonly roll from back to front as part of gross motor development. Pincer grasp and walking typically develop later in infancy. Question 9. A nurse is teaching parents about dental care for their 3-year-old child. Which statement by the parents indicates understanding? A. We will wait until permanent teeth erupt to start brushing. B. Our child should use a pea-sized amount of fluoride toothpaste. C. Only water should be given after brushing at night. D. Flossing isn't necessary until age 6. Which one is the correct answer? The correct answer is B. Our child should use a pea-sized amount of fluoride toothpaste. Explanation. At age 3, children should use a small, pea-sized amount of fluoride toothpaste. This provides cavity protection while minimizing the risk of fluorosis if swallowed. Question 10. A nurse is assessing a 5-year-old child during a well-child visit. Which of the following findings should the nurse expect? A. Has a vocabulary of 500 words. B. Is unable to hop on 1 foot. C. Copies a square. D. Does not play with other children. Which one is the correct answer? The correct answer is C. Copies a square. Explanation. A 5-year-old typically can copy more complex shapes like squares and demonstrate social development through cooperative play with peers. Delayed motor or social skills at this age may be concerning.
Thank you for watching. For more practice exam questions, subscribe to our website at www.ulosca.com.